Hi guys, my name is Trogstad. I'm a senior health sciences major here at Carroll, and I conducted a systematic review of arthroscopic drilling in adults with knee osteochondritis dissecans. The purpose of this systematic review was to determine whether or not arthroscopic drilling influences the change in symptoms such as lesion size, pain, physical ability, things like that for adult patients with osteochondritis dissecans. What is osteochondritis dissecans? It is a condition in joints where blood flow has stopped due to unknown reasons and causes bone and cartilage death. So if you take a look at this picture on the right, far right over here, this area right here looks a little bit different. There is a darker tone to the bone in the x-ray, and that is where the lesion is. So that's where the bone has died, and that is typically how it is diagnosed in patients. So this condition is rare in adults and is typically found in active adolescents. The theory is that OCD is caused by overuse and friction, and when it is found in adults, it's typically because it was overseen when they were a child. So they probably had it when they were a kid, but they either weren't experiencing symptoms or they just didn't go to the doctor, and then it just was overseen and never diagnosed. So after conducting this research, I found that 5 out of 8 studies concluded that there was a correlation between drilling and a decrease in lesion size and evaluation scores. 1 study was inconclusive, and 2 concluded that drilling was more beneficial in smaller lesions and in patients with an open growth plate, rather than adults with larger lesions and a closed growth plate. After finding that arthroscopic drilling is not always the most successful option, I decided to conduct a questionnaire to ask experts on the condition for their opinion. I ended up asking sports medicine specialized physicians and physical therapists a number of questions regarding the causes and the treatment options for osteochondritis dissecans. One response that was interesting to me and that almost all of them had responded was that they suggested stem cell therapy as a possible treatment option for OCD. So stem cell therapy has been used in other degenerative cartilage diseases and have been used in horses and rabbits with OCD. There have been few studies done in humans as well, but mostly just children, and there hasn't been many studies on it. So studies started by growing the stem cells in vitro with synovial fluid from the joint and found that mesenchymal cells from healthy joints display the best results in growth rather than joints that maybe had osteoarthritis or osteochondritis dissecans. Other studies have tested chondrocytes and mesenchymal stem cells in vivo. Majority showed better results with mesenchymal cells over chondrocytes due to the variability in what they can mature into. So if you look at the other picture next to the one that we were looking at earlier, this is from mesenchymal stem cells. So right here, this whiter area is where the lesion was before surgery with the stem cells, and this is what it looked like after. So it looks like it healed pretty well, and the results show that it healed pretty well, and this was in a 16-year-old soccer player who was diagnosed with osteochondritis dissecans. The mesenchymal stem cells are able to grow into the articular cartilage that is already on our knee, whereas in arthroscopic drilling, the same type of articular cartilage cannot regrow, but a fibrocartilage very similar to articular cartilage can grow instead. Some cons of the stem cells are that they are expensive and they're not highly available. It might take a while to get the amount of resources if many people were using them. They also have not done a lot of studies on adults, so it's currently unknown if regrowth is the same in adults with these mesenchymal stem cells. The thought is that the stem cells would work similar in adults as in horses just because of the size and the weight bearing, but children tend to heal faster, so the hypothesis is that adolescents would have an increased healing rate compared to adults. So after all of this, my recommendation based on my research is that after other treatment options have been considered or tried, such as arthroscopic drilling, but they have failed, stem cell therapy could be a successful treatment option for patients with osteochondritis dissecans. Patients should follow specific therapy guidelines post-op in order to maximize results and heal the quickest. If the correct rehabilitation therapy is not followed, then they might not have the results that they were hoping for. More research does need to be done to determine if stem cell therapy is a treatment option across all ages and different stages of lesions. Since it is not highly researched and only used in a few experiments on children, it is hard to even know if that is a successful treatment option, but it does look promising so far. So in conclusion, more research does need to be done to determine the best treatment option for adults diagnosed with osteochondritis dissecans. Arthroscopic drilling is a good treatment option for those with smaller lesions, but when it comes to older adults and people with larger lesions, stem cell therapy could be the next step in their treatment plan. Thanks for listening, guys.